Good afternoon to teacher and everybody in here. It's my honor to be here today to give the presentation. I am Natepiroon Wattanapongsiri, fifth year medical student from the Nakornping Hospital. The focus of my presentation today is the prevalence and risk factors of HPV-related cervical dysplasia. First of all, I have to thank you my advisor. First one, Dr. Anjali Chainwan. And the second one, Dr. Dangchiwan Singh Nangwatana, Diploma Thai Subspecialist Board of Gynecological Oncology, Nakornping Hospital. For the background, cervical cancer is by far the most common HPV-related disease. About 99.7% of cervical cancer cases caused by persistent genital high-risk HPV infection. From the hospital-based cancer register 2022 show that cervix uterine cancer is the second most common in Thailand nowadays. Nakornping Hospital have conducted HPV-DNA testing for cervical cancer screening in targets high-risk women according to the National Health Security Office policy by fiscal year 2022. For the aim of this study, we have two objectives. The first one, evaluate the prevalence for types of HPV infection, and the second, to study the relationship between risk factor and cervical cell lesion progression in Nakornping Hospital. For the method, the study was conducted with all women aged 13 to 60 years old with HPV infections who underwent colposcope and HPV-DNA testing at OPD obstetrics and gynecology Nakornping Hospital. The study payload as retrospective on sectional analytical statistics, analyze the risk factor by binary logistic regression. The predictive models was validated with ROC curve. P-value under 0.05 indicates statistic significance. Okay, now we got the result for 4,027 participants. In this study screening by HPV test, just only 447 patients have HPV infection. 89, 31, and 327 patients were infected by type 16, 18, and other type respectively. The patients who infect type 16 and 18 underwent colposcope, just 77 patients and 29 patients respectively. The patients who infect other types underwent liquid-based cytology for categorized types of cervical dysplasia and continue to do the colposcope. The patients who lost follow-up and pregnancies are excluded from this study. So now we got the object one of this study. The prevalence of type of HPV infection in the continent, the most common is type HPV non-16 and 18, followed by 16, and the last one is the 18. For this sample can reply the objective 2. The women with HPV 16 and 18 infect have the higher risk to develop cervical dysplasia, allowed 2.05 times compared with other groups. And the women who have a sexual intercourse before 25 years old have the higher risk to develop cervical dysplasia, 3.05 times compared with another group significantly. About the predictive models, AOC under ROC is allowed 0.66 is so accuracy of predictive model is about 66%. For the discussion and conclusion, HPV type 16 and 18 is higher risk of precancerous lesions. The sexual intercourse for the first time gets higher risk of precancerous lesions. This should have implications for follow-up protocol of the future HPV-based cervical cancer screening program and for HPV vaccine trial. The limitation, the HPV DNA test screening can in October 2021 resulted in limit sample size of 4,027 women with only 255 testing positive for HPV. The key risk factors such as socioeconomic status, history of sexual transmitted infections, and immunosuppressive therapy was not included in this analysis. Behavior like the alcohol consumption, smoking, and HPV infections show no significant associate with cervical epithelium change likely due to most participants deny this exposure. The study is a cross-sectional design limit to ability of intercausality and retrospective data such as age of first sexual intercourse may be the affected by this call bias. This is my team. Thank you for all.
Thank you. Do you have any comments or any questions?
Thank you for the presentation. I just wonder whether people who got the HPV DNA testing is part of the routine or because patients included in your study, so you get the free testing. So you understand? Like the HPV screening test depend, like because you have their study or because the doctors and everyone after October 2021 or something like that.
Okay, sorry. Okay. The participant in this study, we follow the policies of National Health Security officials have to conduct HPV test. Yeah, for screening in women who age 30 to 60 years old. It's the policies. Yeah, we follow the policies.
Can I see your conclusion again, please? The conclusion. The conclusion slide. Yep. Yeah. I'm not sure that sexual intercourse for the first time, or do you mean age of first sexual intercourse?
Yeah, it's the age of first sexual intercourse. Yeah.
The age of sexual intercourse for the first time less than 25 years of age, right?
Yes, yeah. The first time less than 25, we cut out at 25 years old.
Why you choose 25 years old? Because do you know that the median age of first intercourse of Thai women nowadays?
We cut at 25 years old because when we review the research, yeah, most of the research used at 25 years old. Yeah.
I believe that the median age of sexual intercourse of Thai women in this day is less than 25, maybe something like teens, okay? So maybe you should review a more update data.
Thank you for that question.